Okay, so a very warm welcome to anybody listening in for this short recording. It's a sort of conversational interview. I'm very pleased to be talking today to Alistair Dobbin, one of the founders of the Foundation for Positive Mental Health, and we're going to be exploring a little bit more about positive mental training, what it is, and part of the motivation for having this conversation is the upcoming workshop in February, on the 10th and 11th of February 2016. And you'll find more details about that and links to an information page on the page where you're watching this video. So Alistair Dobbin and his wife Sheila have been running positive mental training for about 9 years now. So Alistair, I'd just like to start off by asking you, could you just spend a few minutes explaining the background to positive mental training and how it all got started?
Yeah, thanks very much, Simon. Thanks for giving me this opportunity to talk about positive mental training. In about, it must have been about 2000, I was running a clinic for people with, in my general practice, I was running a clinic for patients with mental health problems who were referred to me by other GPs on the NHS, and I felt that there was there was quite a lot of opportunities in using particular types of tools. I was also trained as a clinical hypnotherapist, and I developed an interest in what people could do for themselves using self-hypnotic techniques, so that they would listen to recordings that would help them to deal with their anxiety, largely anxiety then. And then we decided that we ran a bit of research in that, and then the chief medical officer in Scotland asked if we could do something in depression, if we could do a study in depression. And I had contact with the sports psychologist in Sweden at the time, Lars-Erik Unstall, who had a great interest in what made Olympic athletes successful in their everyday kind of practice and in the Olympic events. And Lars-Erik felt that what helped them most of all was the ability to bounce back, in some ways to bounce forwards from adversity if they have a bad performance. And it seemed to me that there was a lot of synchrony between that and depression. So I went to Sweden and looked at what Lars-Erik did with the program, and we brought it back and translated it. And I used it just in the patients I had in general practice who were depressed to see what the effect would be. And the effect did seem to be quite powerful, and certainly in some cases quite transformational. The patients experienced quite a remarkable turnaround, and many people seemed to get quite a lot of benefit from it. So then we went on to do a randomized trial, which was very, had very encouraging results, and really the program after that, after it being used in depression, we evolved a workshop to help GPs to understand how the program works and how to use it clinically, because we decided we wanted it to be able to fit it into a 3-minute kind of slot, because of course GPs are very short of time. And so we evolved it into a workshop in which people would understand the program, and then they would give the program to their patients, and they would see their patients when they came back. So, and that's been running, as you say, for about 9 years. Our first workshop was 2006, and we've done workshops with about 1,000 doctors since then, largely GPs, but also occupational health doctors and increasingly psychiatrists.
Okay, thank you very much. And so, Alistair, going on from that, you're an experienced GP. You've been a GP over 30 years, haven't you?
Yeah.
And why do you think the program is so popular with GPs? And you said, is it over 1,000 have attended workshops?
Yes, that's right. We've had over 1,000 people, 1,000 doctors, mainly GPs, probably about 900 GPs. Yes. Why is it so popular? I think as a GP, I found that I didn't have any simple tools that I could use to treat people who were distressed, really, who had emotional distress. And although I was a clinical hypnotist and I could actually spend a lot of time helping them, I thought, you know, I think it's a very simple program. You know, the patient takes it away. You introduce it, the patient takes it away, listens to it, comes back, and then you see the changes in the patient, and they can report back to you the process that they're going through. I think GPs like it a lot because it comes from Olympic sport, so there's certainly no stigma involved in using a program that, you know, has a sort of Olympic evolution to it. And I think they like it a lot because we focus a lot on the neuroscience of why it works, really. You know, neuroscience is actually simpler than one might imagine, and it comes down to a few basic principles which are very, very interesting. And so, I mean, GPs often, when we get feedback, they say, oh, I really appreciated the fact that it wasn't just full of mumbo jumbo, you know, that there is a hard scientific basis to it. I think that's also part of its appeal. You know?
Excellent. And I know you go into some of the neuroscience on the Taster webinar that we ran recently.
Yes, that's right. Yes.
And I don't know whether this conversation is not the right setting to sort of touch on the neuroscience, but if people want to go and look at that, there'll be a link on this page to that longer 1 hour webinar where people can hear a bit more about the neuroscience, I guess.
Yes, that's right. I mean, we've been working with various people in America, experts in neuroscience, who, you know, are very interested in what we're using. So yeah, I think that they should look at the Taster because it has gives people an idea why something that might work for, you know, sport would be useful for depression. Yeah. I mean, many of the doctors who give it out, you know, when they're talking about it to the patients, if they say, well, you know, this came from sport, then patients become more, you know, more engaged sometimes with the process.
Yes, because stigma can get in the way sometimes.
Exactly.
Yeah.
And of course, many doctors use it themselves. Quite a large proportion from our audits of what's going on, the doctors use it themselves because, you know, again, there's no stigma in using it yourself. So then the doctor sometimes can say to the patient, well, I've used this myself. I find it very useful. And that is a huge bonus for patients, you know, if they think that you might be using it. Yes. Also, maybe it humanizes us a bit, you know.
Yes, that's true. Get us down off our pedestal.
Yes.
So could you just say a little bit more about what does it give patients that they didn't have before? Or maybe another way of saying is what do patients get out of doing the training?
I think probably one of the things more than anything is it actually gives them some kind of immediate help. I think often if patients have to wait to see somebody, you know, then it kind of magnifies the problem in their minds, so that they become more worried about the outcome. And really, if you can give somebody something straight away, then they go away with a kind of positive feeling about how they might improve. If you give them even a simple model of what might work, which is what, you know, we do in our workshops, we kind of help people to find a simple way of explaining it, then the patient goes away and often, certainly because it's a kind of mind-body intervention, you know, we use a lot of breathing, particularly in the start. To start with, there's a lot of breathing and muscular relaxation, and in a few days most patients will certainly be sleeping much better. I mean, I think, you know, most mental health problems, then sleep is a major problem. And you know, you can give someone an antidepressant, yes, but they're certainly not going to help them for probably 3 or 4 weeks. I mean, that's what the manufacturers say. Whereas with this, you know, you can say to your patient, well, you know, you're going to sleep well quite quickly because, you know, I mean, once you've given it to a few patients, you will see the effects, and then you can authentically say to the patient, well, I know this will help you sleep, which is usually a good way in. People expect GPs particularly to understand about the body. So when you talk about how relaxing the body will help people sleep, they get that immediately. So it's something quick. It's something rapid and effective.
Yes, and the actual positive mental training audio program runs over 12 weeks, but people
Yes.
can see benefits within 4 weeks. I
Yes.
understand.
Well, our own research has shown, particularly looking at its use in occupational medicine, that we did a study there, and we found that within 4 weeks there were significant reductions in anxiety and significant reductions in burnout. So we do know that it has a quite a rapid effect that way. I mean, the fact we say, well, within a week, is largely due to the observations of the many doctors and health professionals who are using it. Almost everybody will say, well, yes, most people will actually be sleeping better quite quickly.
Thank you very much. And a common question people might have if they're thinking about positive mental training, are there any negative side effects? Because you're listening to audios, aren't you? You're listening to audios 18 minutes a day, and the idea is to do at least 5 days a week.
Yes.
A different track for each week over the 12 weeks. Any negative side effects from doing the course?
Well, we have been obviously asking people to report any problems that there are. Certainly within Edinburgh, we even monitored the people admitted to psychiatric hospitals to see if there had been any problem with people who'd been listening or been given it by their own GP. And really, I mean, one has to say, we haven't had any reports of people having a bad side effect from it, from being perhaps flooded with bad feelings or whatever, which is reassuring, really, because we've calculated about 70,000 people at least have been given this program by their GP or by their health professional. So it seems to be really free of side effects. But we're monitoring the situation.
And could you just go through, Alistair, what sort of conditions that the positive mental training program can be used for? What different conditions can it help patients with?
Yes, well, when we started, the first study we did was in depression, and then later, as I said, we did a occupational health study, and that showed for people with from the NHS actually who had mental health problems, and we got evidence for anxiety, and we got evidence for burnout, and as well as depression from that, and a number of the studies that we've done have shown quite a marked increase in quality of life. Conditions certainly. I mean, it is widely used, certainly within the psychiatric hospital in Edinburgh. It's used for problems with self-harm, for problems with sleep, with problems for problems of addiction, and it's been almost used across the board. I think the point is that there is some kind of universal problem behind most mental health problems. Almost universally, most people will have a lack of self-esteem, and perhaps due to past incidents or so on. And this program, I think, once you've done the body work and you've got the mind relaxed through using input from the body, then later on, after about 4 weeks, people are given the opportunity to reinterpret events, sort of traumatic events that have happened to them, and that seems to be very successful. And perhaps it is tapping into some kind of universal problem that almost any psychiatric diagnosis is underpinned by a lack of self-esteem. If you can boost people's self-esteem, if you can make them feel good, if you can give them positive emotions, it will seem to diminish any kind of negative output. And all these conditions, personality disorder, addictions, whatever. I mean, I think they are all underpinned by a lack of positive self-belief, and that's what we're looking to build up. And it does seem to have an effect in a wide variety of conditions. And certainly, in general practice, if you come and do a workshop, you have the tool. You can give it to as many people as you want, and it takes very little time, and it's actually quite effective. So why not?
Yes, because
yeah. Sorry.
No. I was just thinking, in terms of my giving it out, that we see, when you're sort of switched on to seeing how stress presents itself in so many different ways. People,
Yes.
When I say stress, because you can react in a positive way to stresses, or people can
Yes.
react in a way that's not helping them, not supporting them. So when you see people with anxieties or depression, poor sleep, and when you start looking for it, so there's a lot of it out there.
If I could, yes, absolutely. If I could just also say, I mean, the other big field, certainly in general practice, is psychosomatic disorders and things like, irritable bowel, chronic pelvic pain of any form. And we do find, yes, the pain clinics in Edinburgh are using this chronic pain. It seems to be very effective. I mean, certainly from the neuroscience, we know that pain is very, very strongly based on your emotional state, that if you can actually boost people's positive emotions, it actually diminishes pain. And we do go into the pathways for that when we do our workshops. So there are, as we all know in general practice, we might see a patient with irritable bowel, and most of us know that they've got underlying mood problems. They're probably a bit depressed, as people are who do self-harm and so on. We can sense that they have a certain level of well, we call it functional, these are functional disorders. But almost any disorder, even something that has a very strong biological basis, rheumatoid arthritis, whatever, it has a strong functional overlay. So that if you have these more, conventional inflammation conditions, which have a very strong biological basis, you can certainly help them a lot. You can help the pain a lot by just making them feel a bit better about the future. And that will actually diminish not only the pain, but possibly also the inflammation.
Excellent. Are there any limitations, Alistair, with positive mental training? Any limitations as to where we shouldn't think about using it?
Well, certainly, we don't have, we would say there are certain things you want to be cautious of, not because we found that it's actually caused any major problems, but certainly if somebody obviously is, for instance, people who are depressed may have the beginnings of a bipolar depression, and you need to be aware of that. In young people may develop in a bipolar. So just that you need to be aware that something like bipolar or something like an early psychosis, which again can manifest itself with a unipolar depression, that these things will need certainly to be seen. They'll probably need to be seen definitely by a specialist who would then, I don't think the specialists would be worried, but they might well need lithium or some other treatment, so that needs to be borne in mind, and we do cover that in the workshops.
Yes, and that brings me nicely on to the workshop that we're delivering. I'm helping you deliver this as the workshop in February as webinars, and you've done the workshop around the country as a sort of 4 or 5 hour session broken up into different sections. So could you tell listeners a little bit about the workshop?
Yes. Well, look, a lot of people obviously can't make it to our full workshops, and so what we're going to do is we're going to split it up into 2 sessions over 2 days, and the sessions will run for an hour and a quarter, an hour and a half, and they will cover. We will cover the neuroscience of it in a very simple way, but give people an idea of how that hangs together, and we will also show patient videos, which will be demonstrations of what we're talking about in neuroscientific and psychological terms, and we will discuss how you introduce it to patients, and we have videos of doctors demonstrating how they introduce it to patients and so on. And I think by the end of these two sessions, I would recommend that people watch the taster webinar before actually coming to these 2 sessions as well, because we cover a bit of the neuroscience in that. But by the end of these 2 sessions, we will give everyone access to codes, the app codes, and We have an app which works on all platforms, and we have a website. Our website, you can download MP3s from it. So we say that by the time you have finished these 2 webinars in February, you will be competent to hand out the program and to use it broadly with any kind of patient that you want to, you know. And you will feel the confidence to be able to do that.
Yes,
that's what we're aiming at.
Yes. So the workshop gives colleagues who attend a sort of fuller understanding of the science, the neuroscience, and they see plenty of examples of how it can be introduced into the consultation, and examples of patients giving their feedback on how it's helped them. So I think that, as you say, that certainly after I attended the physical workshop, that increased level of confidence in terms of offering it as an option for patients who you feel are appropriate.
It sounds a big ask. It sounds a lot when you put it like that. It actually is, I think, simpler than people would imagine, you know. I hope so anyway. I mean, you picked it up quickly enough, Simon, so I'm sure it's, you know, most doctors are really interested, you know. I mean, it's nice to incorporate this kind of whole mind-body thing into your everyday clinical practice, you know.
Fantastic.
To see it at work.
Yes. Well, I think I've sort of covered all the questions that I wanted to ensure, and I wanted to ensure people sort of got an understanding from this conversation. And I would encourage people to go and watch the Taster webinar recording, which goes into more detail, as you say, on the neuroscience behind it, and there are some videos of doctors and patients on that webinar recording. So I would encourage anybody who's interested, having listened to Alistair explain a little bit about positive mental training, have a look at the positive mental training Taster webinar, and the link for that is on this page, and also the link to go and sign up for the workshop. There's a link. You click the link, you go to the page, it'll tell you more about the workshop, and you're able to sign up for that. So thanks very much, Alistair, for taking the time out of your busy day to join me in this conversation, this discussion. And any final words for colleagues before we finish?
Well, just have a good festive season, I suppose. And you know, we'd love to see you in February.
Excellent.
Okay.
Excellent.
Bye.
Thanks so much, and look for the links, and hopefully see you on the workshops in February. Bye for now.